Welcome back to Pebbles series, differentiating the difficulties with me, Kavya Tendral. The prime objective of the series is to remember the concept and retry at the critical time of demand, especially the competitive MCQ exam and as well the theory viva. First is cystosoma egg identification. First, let us see what is cystosoma. Cystosoma is a blood fluke, that is a trematode. Let us take the yes. It is skin penetration. That way, this parasite is gaining entry into the body through skin penetration, and one another organism which is gaining through skin penetration into the body is hookworms. Okay, so skin penetration is the route of entry. After entering that, this is a fluke, blood fluke. So it means it has to gain access into the circulation. Okay, but what is penetrating the skin is the circaria. But after entering the body, it turns into cystosomiole, and the cystosomiole is now entering into the liver, that is the portal vein. From there, it is reaching the urinary bladder and the rectum via the venous plexus. By this time, the cystosomiale would have matured into a mature fluke, blood fluke. In the urinary bladder and rectum, it is now going to lay egg. The eggs which are seen in the urinary bladder is cystosoma, hematobium, and in the rectum it is cystosoma mansoni and cystosoma japonicum. These eggs are shed in the stools, and this cystosoma hematobium is shed in the urine. Now let us see the identification. Cystosoma mansoni has S in the name, so it is sharp side spine. Cystosoma hematobium, it is going to come from the bladder and reaches urethra like up down direction. Let us think again. It is the apical spine what we appreciate in the egg of cystosoma hematobium. Next is cystosoma japonicum. In cystosoma japonicum, there is a small hook which is again a shape of J. So with this, we remember this is cystosoma japonicum. This is seen in stool sample. Next is chemotactic factors for neutrophil. Let us remember like this. Chemotactic factor for neutrophil are the substances that is going to recruit the neutrophil, the site of action or injury. Neutrophil is the one which is going to come first along with the monocyte. Now, whenever we get a call, we say, okay, we'll come fast. Okay. So it is K for kallikrein. So remember, I'm saying, and next, neutro, it is like 0. Neutrophils, like we'll put it like another 0 that makes a number 8. It is interleukin 8. When we want to transform this number into another alphabet, we put a line here, it becomes B. Yes, so let us take this again, L, this hyphen as T, and this B, LTB, that is leukotriene B. This is LTB3, let's put 4, leukotriene B4. At last, after B it is C, after 4 it is 5 and A. These are all the chemotactic factors for neutrophils: kallikrein, interleukin 8, leukotriene B4 and C5A. Next is nerve supply of pinna. What we see here is actually the lateral side of pinna. We also have the medial side of the pinna. On lateral side of the pinna, superiorly, we could see the crest of antihelix. We have two things. So it is 2 divided by 3. We'll remember like that. On lower part, we have one lobule, so 1 by 3. Upper 2/3 and lower 1/3 is that division. So upper 2/3 is supplied by auriculotemporal, a branch of fifth nerve, and then lower 1/3 is supplied by great auricular nerve. In between, what we have is the concha. So this concha is supplied by our vagus nerve as well as seventh nerve. Now coming to the cranial aspect or the medial aspect of the pinna, it is just ultra to lateral aspect. Lower there it was 1 by 3. Now here it is lower 2 by third and upper 1 by third. The same nerve, greater auricular lower and upper, it is lesser occipital. Again on conchal side, on the medial most side or cranial most side, it is the vagus nerve. Next we come to thyroid artery ligation in thyroidectomy. Basically, we remember this way: be close to your superior. It means we are now going to ligate the superior thyroid artery very close to the apex of the thyroid gland. Thereby, we can prevent injury of external laryngeal nerve. Be close to your superior. Thank you so much for your patient listening.